I'm in our procedure room now, joined by April and also physiatrist Dr. Tim Davis. Thank you both so much for being here. You look very relaxed for someone on the exam table, because we're actually going to do right now a procedure to help with April's tennis elbow. And while we're doing this, we're going to talk a little bit about how you get tennis elbow, ways to correct it. But this is something new.
It is new. Tennis elbow affects about 2 to 3 million people a year. And it's a pretty disabling type of injury because it affects any time that you grip. And so it's caused by scar tissue that is built up in the tendon on the outside of the elbow. And what we try to do is go and remove the scar tissue.
And I had tennis elbow for a few years from tennis itself. Not that I'm any good at it. Luckily, it eventually went away with rehab. Now, for some people like April, though, they've tried everything.
That's right. We usually start with anti-inflammatory medications, bracing, physical therapy. And then if those things fail, we start with injections, like steroid injections or platelet-rich plasma. Sometimes those things fail. And historically, we've moved on to a surgical intervention. But unfortunately, traditional surgery for this type of issue usually requires about a 2-inch incision. And so it's somewhat counterintuitive to make a big incision to go and try to remove scar when you're creating actually more scar by doing it.
So while you get started here, you're using a newer, less invasive procedure. Walk us through what you're doing here for April.
Yeah, so what we'll be doing is isolating the lesion with an ultrasound. So number one, this makes the procedure less invasive as it is. And we can see there's a little black spot just on the outside of her elbow. And that's actually the scar tissue, and that's exactly what we're going to be going for. This is an 11-blade scalpel, and we're going to take it right in to where that lesion is. You should be able to see it.
And April is completely numbed up for everyone watching, right?
Yeah.
You don't feel anything.
I don't feel anything.
Okay. So.
All right. And so we can see the tip of that scalpel going right in to where that lesion is. And then we'll use our handheld device here. And this is just an 18-gauge needle, and what it is it uses ultrasonic frequency or oscillation of the needle to go ahead and remove the tissue. There it is. See, the tip of the needle is right there on the lesion. Now we're going to start removing the scar tissue. And the ultrasonic frequency, to put this in perspective, this blade is actually moving faster than the speed of sound. And so otherwise, it's a normal needle. And I liken it to if you had a handful of sand and you threw it at a wall, nothing really happens. But when you apply the speed of a sandblaster to a wall, it'll take the paint off without hurting any other tissue.
And so this is a really quick outpatient procedure. And
yeah, we're actually about done.
How quickly till April will see the benefits of this?
She will see in about 4 to 6 weeks. She'll notice a reduction in, well, she'll actually be able to return to regular activity, but she'll notice a reduction in her pain right away. And that's it, actually.
So you're done.
Yeah, she is done.
And really quickly, tennis elbow is essentially a tendonitis, inflammation of that tendon, right?
Yes.
And so repetitive measures, so things people can do at home if they're starting to develop symptoms of pain, the outside of their elbow here, braces, anti-inflammatories.
That's right. There's also topical types of anti-inflammatories you can get over the counter. You can put those on to begin with. A lot of it comes down to decreasing the usage, whatever normally causes it, decreasing that, and then it will usually go ahead and settle down. But sometimes it does not settle down, and that's when this comes into play.